Now Dr. Kevin Cullen. Okay? Dr. Cullen is a professor of medicine at the University of Maryland School of Medicine. He is also the director of the University of Maryland Marlene and Stewart Greenebaum Cancer Center. Dr. Cullen is a member of the American Cancer Society National Board of Directors. He also serves on the board of directors of the Association of American Cancer Institutes, and most recently was appointed by President Obama as a member of the National Cancer Advisory Board. It is under Dr. Cullen's leadership that the University of Maryland Greenebaum Cancer Center achieved National Cancer Center designation, and this is an NCI, National Cancer Institute designation in 2008. And this is a unique accolade that is afforded to only one of 66 such cancer centers across the country. There are 900 cancer centers, and we're one of them, but most importantly, there are only 66 of the 900 that are actually designated by the Cancer Institute. In 2012, the Cancer Center that Dr. Cullen leads was ranked by the U.S. News & World Report number 11 out of 900. Dr. Cullen, unfortunately, cancer is our number 2 cause of death in America, and we've made some inroads, clearly, and people are living longer with cancer. It's, in some respects, it could be considered a chronic disease in some aspects. What are some of the risk factors that individuals should be mindful of with regard to cancer? And particularly what research programs that are underway within your cancer program that you think is really truly making a difference in the life expectancy of those suffering with cancer? And I leave it to you open to carve out the cancers as you see appropriate.
Sure. Thank you. Well, first of all, thank you for all of you being here, and I want to reiterate, Al, your thanks to Stewart and Lynn Weitzman for their wonderful support over the years, and we're also very fortunate to have Michael Greenebaum here. Michael's parents, Marlene and Stewart's visionary support of the Cancer Center has really gotten us to where we are today. When I talk to the medical students or the residents, I try and make the point that cancer is changing and evolving very, very rapidly. There are about 1.6 million new cases of cancer in the United States every year. Still about 600,000 deaths. It actually is the leading cause of death in adults in the United States, except for the very elderly. Once you get to be in your 80s and beyond, cardiac disease becomes more of a threat. But for the majority of people in this room, and in the age group in this room, cancer is the leading cause of death in the United States. But it's getting dramatically better. When I was a kid, when I was a very small child, my grandmother was diagnosed with breast cancer. At that time, in the late 50s, if you were diagnosed with cancer, your chance of surviving in the United States was 1 out of 3. 2 out of 3 people died, 1 out of 3 survived. When I entered medical school, it was about 50-50. Today, 2 out of 3 people diagnosed in the United States with cancer are cured of their cancer. There are about 3 times as many cancer survivors in the United States today as there are people who live in the state of Maryland. So there are about almost 15 million cancer survivors, and that number is going up rapidly. So the landscape is changing very, very rapidly, and we're doing much better. Cancer mortality peaked in around 1990 and has been dropping fairly steadily since. Cancer mortality is dropping about 2.5% per year in the United States because of better treatments, better diagnosis, but people taking care of themselves, specifically around smoking. You asked what are the risk factors, what are things that people can do. I was at a function a while ago, and I happened to be introduced to the Secretary of Agriculture, Mr. Vilsack, and he asked a question that a lot of people ask me when they're first introduced and they learn what I do. Will we ever have a cure for cancer? And I said, in a perfect world, you as the Secretary of Agriculture, with a stroke of the pen, could eliminate more than almost 2/3 of the cancer in the United States with the stroke of a pen. And he looked at me like I was from Mars. And he said, I'm the Secretary of Agriculture. I said, if you could, by stroke of pen, say there would never be a tobacco product sold in the United States again, about 1/4 of cancers would go away. If you said every time someone walked into a McDonald's and they offered a double Big Mac, the cashier said, "Could you step on the scale, please?" and if your body mass index was above 25, they'd say, "Sorry, no Big Mac for you today. Come back tomorrow." And I said, you know, those issues of courts and things like that. I realize it's a little more complicated. But the point is, most cancers are preventable. If we eliminated smoking, if people kept their body mass index, obesity and inactivity probably cause another 25% of the cancers. Obesity is associated with a dramatic increase in the risk of colon cancer, breast cancer, endometrial cancer, prostate cancers. All of those would fall dramatically if people exercised, and to Steve's point earlier, the benefit in diabetes would be dramatic. We're also appreciating that lots of, or an increasing number of cancers are due to preventable infections. Viruses cause cancer. The viruses include papillomavirus, which causes cervical cancer, many head and neck cancers, other genital cancers. Hepatitis virus causes an enormous amount of morbidity and mortality from liver cancer. HIV/AIDS. People, when I was in medical school and a resident, people who had HIV or AIDS died of infections within a few months. Now they live decades and they die of cancer. So many of these viruses we have vaccines for. Other of the viral infections are preventable. So really, applying what we know now, we can dramatically reduce the impact of cancer in the United States. And one of the failures that we as a profession, and I think the public as a whole, faces that we focus appropriately on many levels on the research for new treatments and new diagnoses, when we don't put enough effort as a nation, as a society, into putting in place what we know, because that will have a very dramatic impact today or tomorrow. Couple of examples of research that I think have taken place at Maryland that are very important and have had a big impact. A number of you have heard me talk about the groundbreaking work of Dr. Angela Brody. Dr. Brody has been a long-standing member of the faculty, and a number of years ago she invented a class of drugs called aromatase inhibitors. Aromatase inhibitors have been the single most important advance in the treatment of breast cancer in the world in the last 25 years. I'll say that again, the single most important advance in the treatment of breast cancer in the last 25 years, invented at the University of Maryland. When her drugs were introduced a few years ago, they were first shown to reduce a woman who had breast cancer, reduce her risk of having a recurrence by 40% or more. 2 years ago, a study showed that if women who were at high risk of developing breast cancer but didn't even have it, you could cut that risk by 65%. Better than any of the interventions that Dr. Davis had talked about in preventing diabetes. So we can prevent breast cancer in 65% of women who are at risk. And then this past year, in collaboration with Dr. John Olson, a surgical oncologist that Steve recruited from Duke, her drugs were shown to, for women who had locally advanced breast cancer and who would have required a mastectomy or complete removal of the breast, treatment with these drugs can reduce the need for a mastectomy by more than 50%. So that's one example of research at Maryland that we're very excited and very proud of, and that has had a huge impact, not just locally, but around the world.
Thank you. Dr. Cullen, let me follow up on that and say, for example, we talked about the fact that the cancer center that you direct is clearly very unique, very distinguished. There's no reason why, one, it has gotten the National Cancer Institute's designation, one of the 66 in the country. The U.S. News and World Report ranks it so high. What makes it so special? Why is it rising so rapidly? What are some of the things that you'd like to share with us?
Sure. Well, I think there are two aspects two answers to that. One is the excellent research, which is really a main focus for the NCI, and the work of Dr. Brody, which I mentioned, is a leading example of that. In terms of clinical care, we have really worked hard to recruit excellent faculty and build multidisciplinary teams, and that's critical. And the important thing to remember, if you or a loved one gets cancer, simple rules. Your mouse is your worst enemy, your phone is your best friend. People make the mistake all the time of going online and just trying to figure this out and click their way out of cancer. You can't do it. What we provide in a multidisciplinary setting is a team of experts who can look at you, look at a loved one, and say, we understand your problem, we know the multifaceted way of treating it, and we can come up with a unified treatment recommendation. Studies have shown that if you're treated in an NCI-designated center like Maryland, you're 25 to 30% more likely to survive if you have common cancers like breast and colon cancer than if you're treated in a community hospital. And that's because of the multidisciplinary teams of experts that we bring to bear. So an important thing to take away from this, if you or a loved one has cancer, you don't necessarily have to travel to Baltimore to get all your treatment. We would love to see you and love to see you. But it's tremendously worth it to at least make that trip initially so that you have an appropriate treatment plan, that a really good team of experts is focused on giving you the best answer and the best treatment. And there's clear data now that shows that the outcomes are better if you do that.
And I think I take it that you'd want to say that that all cancers are handled within the cancer center scopes, all major cancers. So if someone had a relative, a loved one who they needed information on, and they had to make that call, not go to the mouse, but by the phone.
Right. Pick up the phone, and I get 2 or 3 calls referred by Stewart or Michael, and we love to get those. So very, very seriously, if you ever have, God forbid, this kind of an issue, but you all likely will, either in your own lives or with someone you know or love. Pick up the phone, and we can help guide you, and that's part of what we do, and it's part of our responsibility, and I think we're good at it.
Thank you very much, Dr. Cullen.